Hi, I'm Dr. Angela and today I'm going to be discussing dissolving dermal filler. So this can be done. So I get a lot of people who come in or email me and they have anxieties around getting filler and whether it's reversible or not. So hopefully a lot of clinics out there are able to do this and are using products that allow this to happen. The products that are required to enable dissolving to occur is hyaluronic acid. The enzyme, the product that is used is an enzyme and it breaks them down, and this is hyaluronidase. So it is quite simple in that sense, but a lot of clinics might still be using products that aren't able to be dissolved, but just make sure before you have a procedure done that you do ask if what you are having done can be reversed. So questions I get regarding dissolving is what and why we would do this. So there are a multitude of reasons why we would dissolve dermal filler. So it can be that the filler has migrated from where we wanted it to be. So for example, if it was within the lip but it's migrated above or below, whether there's lumps or bumps, or whether that person just doesn't like the outcome, that the look that has come from the dermal filler. So it's quite simple. The solution is prescription only, so a lot of clinics again are unable to do this, so you do need a doctor prescribe it, someone basically who can prescribe. It is a medication, it needs to be prescribed in the patient's name. Obviously in emergencies this is a completely different story. It does need to be prescribed for the person. You come in for a consultation and we have a little chat about what you want doing and why you want it dissolved. But I will say this, if there is a reason why you want something dissolved and you haven't had the treatment with us, I will suggest that you do go back to your previous clinic and ask them to do this for you. I know obviously sometimes this can be a bit awkward, but for anyone's insurance purposes, it does make it quite difficult if something was to go wrong for some of the clinics. So do ask them if they're able to reverse it for you. Obviously I understand that this can't be done in all of the situations, but we can sit down and discuss that if that is the case. Reasons in which it's dissolved. So migrated filler, this can happen to the best of injectors. I know obviously we see some awful fillers and looks out there, but we've got to remember that some of the girls who have this done have asked for that, so we have to be quite mindful. But migration can happen to the best of people. It can be that there's too much product, it can be that it's not placed in quite the right place. So I'm going to show you an example of a woman who has had dermal filler over a course of several times. She had very small lips to start, but unfortunately she's had a bit of migration above her border, and this has occurred because her lips are unable to hold that much product within the borders of the lip. But when she came in, we were able to focus exactly where to dissolve, and this meant that we didn't actually dissolve the entirety of what she has in her lips. So there will be an example just here for you to see. This was quite easy to do, but I will not sugarcoat this. With dissolving, it can hurt. It can be like a bee sting. Obviously, the pain does go away straight away. So you inject, you get the bit of the stinging. It does hurt. It can hurt for some. Some people better than others with dealing with it, but it can hurt. You can get swelling, and you can get significant swelling. So if you are planning to get this procedure done, just make sure that you're not anywhere important the next few days. It does take a while to settle. And you can also get bruising. Again, some people can get really significant bruising and some people just have minimal. So until this is done, you won't know what level you are at with your bruising and swelling and what to expect. So again, lumps and bumps, the dissolving agent can be focused to certain areas. Again, with the migration as well, we don't have to dissolve everything. Obviously within consultation this will be looked at, but it doesn't have to be that everything has to go and you have to start again. In some situations it can be focused. It doesn't have to be the whole lot. So there's a lot of anxiety around that with some girls who's obviously built, for example, their lip fillers over several years, but they have a lump or they have some migration somewhere and that's the only thing they're unhappy with. Sometimes this can be the areas that we can just focus on. Also, we need to manage expectations. Please, please, please don't expect that you can have one sitting and you can get rid of the dermal filler that you're unhappy with. Sometimes it may need a couple of sittings, 3 sittings, 2 sittings. Some people can get this done and achieve what they want in one sitting, but just make sure it can be that this is not the case for yourself. We'd know this within a consultation. If you do have any questions about this, and if there's anything that I haven't covered, please just let me know, send me an email, and I'm happy to discuss anything regarding dermal fillers and dissolving fillers. Thank you.